from a narrow attitude of screen film system to a wide attitude could easily result in overexposure of patients without knowledge of a radiographer. That's why it could be important that the radiographers and technologists that will be using TRA system as we are shifting should be able to be trained adequately, even in-house, so that they can have adequate knowledge and skills about the TRA system, so that they can be able to minimize the possibility of overexposing of patients. Then another challenge that we have is that of the shortage of medical physicists. These medical physicists, they apply both physics and medicine to assist clinical staff in diagnosing diseases and as well as treating patients. And they are very important. They play a very big role in radiation protection. So they achieve this by helping us to select the appropriate equipment during the procurement process, designing appropriate diagnostic imaging or treatment rooms that are capable of containing the ionizing radiation. They are also helpful during the acceptance and commission of the equipment and putting in place a quality assurance programs. Also educating and training staff on radiation protection and providing staff in complying with the regulations on radiation protection. And where medical physicists are available in hospitals, mostly they are the ones that are even radiation protection officers. So now currently in Zambia, we have got about 6 medical physicists who are working in Zambia. 2 have been absorbed in the private sector, and they are responsible for quality equipment in all 141 public health institutions across the country. So this works out with 1 medical physicist for every 35 facilities for the remaining 4 medical physicists that we still have in the public sector. So now that the number is very little, so what has happened here in Zambia now, that you find that these medical physicists, mostly, they just pay much attention and their focus is on radiotherapy and less on diagnostic imaging, despite being the largest area of radiation protection in healthcare, as well as it was also even observed by Kawesha when she did a review research. So the shortage is due to lack of medical physics training programs within Zambia. But however, there are plans to introduce a bachelor's degree in medical physics at Yunza, as well as at Murungushi and Lusangu University. Then another challenge is that of the shortage of radiologists. In Zambia, there are currently about 9 radiologists working in public hospitals, servicing a population of approximately 18 million. And the obligation of these radiologists for radiation protection of patients also includes a review of the appropriateness of the diagnostic imaging examinations and optimization of protocols. Radiologists are also responsible for reporting, but they also perform radiological examinations such as fluoroscopy studies, interventional radiology procedures, as well as the consultation services too. IAEA advises that in the absence of referral guidelines, it's important that radiologists are consulted by requesting medical practitioners if they are unsure of which imaging exam to request in each clinical situation and problem. Furthermore, radiologists provide radiation protection training to staff involved in imaging examinations, such as the medical practitioners. So to increase the number of radiologists, Ministry of Health currently, they are running a specialized radiology training program for medical doctors and turn them into radiologists. Another challenge is the inadequate personal radiation protective equipment. Monga in his study revealed that there is a limited number of PRPs available for clinical settings, and these are unevenly distributed between urban and rural parts of the country. So this is a challenge in protecting imaging professionals from scattered radiation when performing examinations which require them to remain in the radiation field, such as fluoroscopy, mobile, and theater radiography. So these are some of the examples of the PRPs that we need to have, which are not adequate. The mobile productive screen, the lead gloves, the thyroid shield, and the red glass goggles and the gonad shield. So it is necessary to increase the availability of radiation protection clothing and accessories in all health facilities with X-ray machines. This can be done by our friends who are heading departments. As you procure these things, you can manage, you can always make sure that you provide these things in the budget so that they are bought, and those that are representing us at the ministry, they can probably also be considering that when things have been bought, even PRPs can be bought. Another challenge that we have is the non-availability of a radiation protection training program. We know we have got radiographers and technologists in healthcare institutions, and these are playing a key role in radiation protection. But for specialized tasks, we should undertake radiation protection education training at postgraduate level, at least, as it has been recommended by ICRP, as well as even by the study that was done by Vano et al. In 2018. Therefore, we need to seriously undertake and come up with a radiation protection course which should be developed. But there are plans to develop a postgraduate diploma in radiation protection at the University of Zambia to be spearheaded by RPA and NCRP of United States of America. Another challenge also is the lack of maintenance and testing of diagnostic equipment. The study that was done by Monga showed that there were some inconsistencies. In equipment maintenance, and this leads to the use of malfunctional equipment. Yes, the study was done in 2016, but currently what we are seeing in most of our institutions, this is more apparent. Things are not working due to lack of maintenance. So this is attributed to the lack of having biomedical engineers in our country. So what has been done is that Ivarin Horn has introduced a course in biomedical engineering. Hopefully, when we have got more graduates, who have more people to be able to service and do the maintenance of our machines. Then another challenge is limited data on radiation doses and non-availability of dose reference levels. RPA is able to monitor us as radiation workers, and the study that was done by Monga showed that most of the technologists and radiographers were within the monitoring limits as recommended by ICRP. Those are the monitoring units that RPA recommends, and that study showed that most of us were within that. But however, there's non-availability of dose reference levels in Zambia. As we know, the objective of TRA Health is to help us avoid excessive radiation dose to the patient that does not contribute additional clinical information or value to the imaging task that we are doing. Therefore, typically, we need to make sure that we start applying these DRLs for local imaging facilities to establish a reference dose for common imaging protocols that can be compared with the national and regional DRLs. So that's just a table to show the recommended dose reference doses for general radiography for individual radiographs on adult patients. Of course, this is not ours, but this is what we need to do as well. So this should be done and implemented probably at surgical level, national and local levels, as per recommendation by ICRP, so that we can be able to monitor the radiation doses that we are giving to patients. For radiotherapy as well, in order for us to monitor the radiation doses that we are giving the patients, we need to develop and implement what is known as an in vivo dosimetry program. There are three groups. Another challenge is lack of knowledge about radiation protection among medical practitioners. And mostly in Zambia, there are three groups of referring medical practitioners. These are medical doctors, clinical associates, and also clinical officers. Referring medical practitioners are key players in reducing radiation doses to patients through the justification of medical exposures as they request. But the research that was done by Swiller and his group, it was found that there was no evidence of any component of radiation protection in the medical curriculum for medical students at the University of Zambia. And these are the ones that we're expecting that they should have this knowledge so that they help us in justification with the way they will be able to be requesting for exams that involves medical the exposure. Also, a research that was done by Wanga showed that which was looking at the knowledge, attitudes, and practices of referring medical practitioners regarding the justification of radiological examination at the Ndora Teaching Hospital, also revealed that the overall level of knowledge of the majority of medical doctors and clinical officers was below average. And this could be attributed by what Swiller and the group also found, that is maybe due to the non-inclusion of radiation protection in the medical and clinical medicine curriculum in Zambia. ICRP also recommends that all healthcare professionals utilizing radiation should include the radiation protection component in their curriculum. This includes referring medical practitioners such as medical doctors and clinical officers. So this is just supports what Swiller also had found and Wanga had also found in his study. So that if we had this, probably maybe there could be some improvement if it's included in the curriculum. So another thing is about the unjustified medical exposures and non-availability of referral guidelines. Referral guidelines helps medical practitioners with clinical and diagnostic problems. This could be a list of some possible imaging modalities with the band of radiation exposures involved. Then the levels of radiation doses for each type of procedure and recommendations on whether or not the investigation is appropriate, and explanatory notes on each modality, especially for a country like ours where we don't have a lot of radiologists to consult. We need the guidelines to help our medical practitioners out there. So you'd find also that a study was done here in Zambia, and it was found that the majority of final year medical students did not know about imaging referral guidelines as a tool in reducing unnecessary medical exposure. And that was at 86.2%, which was quite a huge number. And there is evidence that a reduction in the number of imaging examinations requested and performed could be achieved using referral guidelines. But alas, you'd find that the people are in the final year and they are not actually aware about these referral guidelines. So this is just an example of a table for referral guidelines. So for instance, we can just look at this one condition on penetrating abdominal injury. There are about 3 options here that can be done. A CT can be done, and there's also a band of radiation, which will show you what the radiation that will be, the amount of radiation uptake. And you can see the bands reducing for the X-ray supine, chest X-ray, erect, and ultrasound. And there are also comments that can really guide someone to pick up on which imaging modality they can be able to do, so that there is proper optimization and justification as we request for these examinations. So the solution should be that there should be a need to produce local diagnostic imaging referral guidelines. And this should be based on local diseases and resources that we have in Zambia, because that's the only way it can be able to work out. We have to know the pattern of diseases and the resources that we have, so that even when we are giving an alternative in the referral guidelines, we should be sure that this type of imaging is widely spread. So this should be produced in collaboration with the Radiological Society of Zambia, COAS, and the Zambia Medical Association. Then another challenge is that of lack of clinical audits in the radiological and the radiotherapy practices. There's purely a lack of clinical audits in both practices for diagnostic and therapy. Clinical audits are essential for improving the quality of diagnostic imaging services. Therefore, imaging professionals have a responsibility to develop and implement clinical audits, whilst professional bodies like ours, RICZ, have a role in developing the guidelines. And there should be a need, there is actually a need to establish a national clinical audit program of radiological and radiotherapy practices, so that we can be able to improve, this should be even as part of quality assurance. So RICZ, COAS, and MAS should develop medical imaging guidelines for each members regarding clinical audits. Then another challenge is the scarcity of research on radiation protection in healthcare. A research that was done by Fura in 2015 noticed that there's lack of research in radiography, and this includes radiation protection. So medical physicists, radiologists, radiographers, radiation oncologists, and radiograph technologists, we are all responsible for research related to radiation protection. We need to come up and do more research on this. Then in conclusion, there's need for a local medical physicist education program should be developed in order to increase the number of medical physicists in the country. There should also be need to introduce radiation protection education program. And lastly, countries in Southern Africa could work together through groupings such as SADC to develop regional regulations and guidelines on radiation protection. Thank you. That's the end of my presentation.
Thank you so much, Mr. Chanda. This is really...
Any questions?
Thank you so much, Mr. Chanda. The presentation was really comprehensive, and I think you've brought out a lot of issues. And one important thing that you've brought out is despite explaining the challenges to radiation protection, I think there are also possible solutions.
That's the end of my presentation.
Hello, Mr. Chanda.
Sorry to disturb you, Mr. Mlenga.
Yes.
I think, Mr. Chanda, there should be something wrong with, I don't know, his speakers or something. It's like we can get him, but he can't get us.
Okay.
Yeah, sure.
Okay, so will it make sense now to go ahead with questions?
Okay, in the chat room, I can just see we can hear you, Mr. Chanda.
Yeah, so I think
And I think that was
maybe let's just type something in the chat room to say we can hear you, but I think you can't get us. Then we can have our questions in the chat.
Okay, then we can go ahead with the questions, clarifications, and contribution to the presentation on the challenges of radiation protection. Otherwise, he has brought out a lot of pertinent issues regarding radiation challenges. So we can please go ahead. Then Mr. Chanda will try to respond, and others who may have responses to the questions. Thank you so much. The floor is open for questions and contribution.
I'm done. Do you have the moderator?
Yes, Mr. Chanda. Mr. Chanda, we can't. It seems he's having a challenge with a. Maybe we can just type for those with questions. So the question has been asked, or you are just commenting questions and clarification. Mr. Kafuimbisa, you can go ahead with some questions and contributions.
Well, I don't have any question, but if there is anything that, if there is a question somewhere and Mr. Chanda is not able to respond,
Yes, it's true. I'm getting you. I can't get you. So if there are any questions, they can come in the chat.
Okay, I think
maybe
yes.
Mr. Mlenga, since you asked
Yes,
me, you poked me.
Yes.
Mr. Chanda made reference to a radiation protection program, which I can actually confirm that that program is in the pipeline under the University of Zambia. So it will go all the way from, it's a postgraduate program. And it
I'm
will
waiting
go
in the chat to see if there are any questions.
It will go all the way from postgraduate diploma. And if you opt to do a research project, then you can go all the way up to master's. And that program, in fact, today, the financier approved it. So it's going out to Senate for approval and then commencement probably by mid-year, between mid-year to end of year. That program will be starting. It's an international program, so we'll receive students from within the region and of course within the country. That I can confirm. Thank you.
Thank you so much, Mr. Kafwimbi. That is good news for the professional. And at least we have official information, and
it's a rumor.
The program has been confirmed. It's not a rumor. I think it's confirmed. We are getting it from the people in the academics. So thank you so much for that confirmation. We can type. Mr. Chanda is waiting for any questions in the chat room, so we can go ahead with the questions. The house is quiet. Questions, contributions?
I'm not able to hear you, and I'm not seeing any questions in the chat. So can we consider that there are no more any questions? Okay, waiting.
Mr. Soka, sorry, Madam Soka, you can go ahead. Maybe just go in the chat room, or you can verbally ask the question. Mr. Kafwimbi is here to respond if the question is. You can go ahead, Madam.
Thank you so much. Sorry, I forgot that we had a meeting this evening. I've just joined in. I just wanted to say hello to everyone. Good evening. Thank you.
Thank you so much. You are welcome. questions, contributions? It seems we have no questions. At this juncture, I'll hand over the...
So those of us who are interested in doing radiation protection at UNZA, we can just keep our ears to the ground. I'm sure something will come up very soon. I'm sure our colleagues will be able to inform us.
Okay, at this juncture, I would love to hand over the host to the Secretary General and allow him to give any updates regarding the meetings and everything. It seems there are no questions. The presentation was straightforward. I think the rest we can ask through the WhatsApp group for RCAZ. So we go ahead. Mr. Kapapa, please, you can take over from here. Thank you so much.
Thank you so much, Mr. Mlenga. And I would like to thank you, Mr. Chanda, for this wonderful presentation. Despite having these challenges, you know, we are in this era of technology. However, I think it has been done. The presentation was okay and everything is okay. I don't see anything in the chat. There are no questions. I can only see people appreciating Mr. Chanda for his presentation. I think it was on point. For the few announcements I have, the Radiological Society of Zambia is still conducting a data, let me just say a data survey. So all those people within Zambia who haven't completed that, please make sure you do that. Again, I'll mention about the subscription. It was 300 initially. It has been brought down to 250. Please, let's make sure we subscribe. And for the meetings, we have, I think, 3 more presentations coming. We have one, I think, in the next 2 weeks or so from Radiology Without Borders. If they are not going to able to present, we'll have one from Radiological Society of Zambia.
Thank you, and bye all, and sorry about the small technical thing that was there when starting.
Okay, I think Mr. Chanda is a little bit tired. We can excuse him for that. Otherwise, at this point, I just want to thank everyone who has attended the meeting, and please excuse us for those hiccups which we had. Thank you so much. Unless there's something.
Thank you, SG.
Thank you very much.
Thank you so much. Have a good night.